Dear colleagues, it's a pleasure to present our experience of using Soluble in COVID infection patients under hemodialysis after the first wave of the pandemic in Athens last spring. Soluble is a protein in the blood that has been described to reflect the severity status of systemic inflammation. At the same time, an elevated level of Soluble has been independently associated with incident chronic kidney disease. We investigated the association between admission of Soluble levels and severity and outcome of hemodialysis patients with COVID-19 infection. In observation study, which was our study in adult hemodialysis patients with COVID-19, we measured Soluble levels in plasma samples. The timetable for those measurements were as follows: at the beginning of admission, after hemoperfusion for those that received them, and just before discharge. Of the 17 patients, 13 patients received hemoperfusion. The median Soluble levels was 12.94. For those who undertook hemoperfusion, Soluble levels decreased to 10.55 without significance in this decrease. 3 patients had Soluble levels below 7. 2 of them survived without developing pleural infusion. 7 patients discharged from the hospital with median Soluble level 12.94, which did not differ significantly from the median Soluble levels of the deceased ones. As a conclusion, it seems that admission of Soluble levels in hemodialysis patients hospitalized for COVID-19 do not seem to be predictive for their clinical course in general. Chronic kidney disease background and its relation to Soluble levels, independently of patient inflammation status, may be the key component for this notice. Despite that, in patients with low levels of Soluble combined with the absence of pleural effusions, the prognosis was excellent. Thank you very much for your attention.